Davis. Yes. Well, good afternoon, everyone. We want to welcome you to the Caldwell County Board of Health meeting. This on October the 6th at 2022. We're a little earlier than normal with a 4 p.m. meeting, so we appreciate everyone making accommodations to be here a little bit sooner this afternoon. So do we have anybody here that wants to speak on behalf of the public or public comment signed up? No one. So with that, we will go into our invocation. I'm going to ask Dr. Davis if he would lead us in that. And then our Pledge of Allegiance. I'll ask the Honorable Wayne Rash if he'll lead us in our pledge this evening. So,
would you bow your heads with me, please? Almighty God, we thank you for this wonderful weather that you've provided today and for the next coming week. We thank you for the harmony that is here with our staff, with our health department, with our commissioners. And we know that these are times of binary thinking and divisiveness, but help us to be more inclusive and help us to be more in harmony so that we may serve it for a common good, those in the county. Thank you for this staff. Thank you for the board. In Jesus' name we pray. Amen.
Amen.
Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Thank you, everyone. So that leads us to announcements with our health director, Miss Anna Martin.
So I have a few announcements, not many tonight, but I did want to invite you to our Thanksgiving lunch. So Libby will send an invitation out within the next few days. It'll just be with our staff. We're going to do it at the Civic Center this time. It'll be really nice, but she'll send an invitation here shortly. We did have a preparation HIPAA audit, and what that means is we asked someone to come in and oversee and look at our HIPAA, I guess it's more of our policies and what we have going on to see if we're HIPAA compliant and what we could work on. There's a lot of things that we need to work on, but things that's been in the health department and with IT and things like that, that definitely needs to be changed. So Libby has taken action on that and we're working on it. Otherwise, it's been well. You might have heard about Medicaid tailored plans that was coming up, but just like the transformation, it's been extended. So Medicaid tailored plans has been extended to April 23. Did want to mention why we canceled our flu drive-through. It was, of course, because of the hurricane that came through. We were very hesitant. Jeannie and I watched the weather. We were really trying to figure out what was going to happen because as soon as we called it off, it was probably going to be beautiful. But then if we didn't call it off, it was going to be really rainy, nasty weather. So we went ahead and for the good of the citizens and called it off. But we do have flu vaccines going on at the health department. You don't have to make an appointment. You can just walk in at any point, and they'll help you out with that. I did want to mention we do have a new management team member. I don't see her in the audience today, but it's Tammy Roy. She is our WIC director. That's all I got.
All right. So, and I want to say this and tying into your announcements, but a few of us this afternoon got our flu vaccines here. We didn't do it live on the air this time in case somebody fainted. No. but we did get that accomplished, and we appreciate the staff being willing to come over and be a part of this meeting and take care of that for us. I, for one, do. So, but we do appreciate that. So with that, then I will entertain a motion. Well, let me ask first, are there any agenda amendments to our agenda this evening? So no amendments, and with that, I'll entertain a motion that we adopt the agenda for this afternoon's meeting.
Motion we approve the agenda.
Second. Second, all right, thank you. All in favor, say aye. Aye. Any opposed? And that carries unanimously. We did receive in our packet the minutes from our August 4th meeting, and I trust you've had an opportunity to look through those, and if so, I'll entertain a motion that we adopt those minutes.
Move to approve.
Second.
All right, all in favor, say aye. Aye. Any opposed? And that carries unanimously as well. And that brings us to our financial reports. I see we need approval of those financial reports, but we're going to have a presentation first.
Good evening.
Okay. All right. Ms. Jeannie Walker, thank you.
Okay. For our budget ending our fiscal year 21-22, you should have that in your packet.
Yes.
So we expended 74% of our allocated budget and received 80% of our revenue. So any questions with that?
Anybody? Nope. So do we need to have a motion on that?
No, that was just.
Okay, just information.
Okay, and then for our current budget, which is ending the month of August, you know it's usually a month or two behind. Let me find that. It was in my packet a minute ago. That we've expended 14% of our allocations and received 13% of our revenue. So we're pretty much on track for that.
All right. Anybody have any questions where we're at there? Carry on.
Okay. And then we have a couple budget revisions in the packet. You should have those. There should be 3 budget revisions. Okay, the first one should be in our BSEP funding, and that's breast and cervical cancer. And there was a statewide decrease in all those allocations. So we had a decrease in that of $5,525.
All right. So we need to have a motion on that budget revision of the, so I make a motion that we approve this revision in reflection of $5,525.
That's
I'll
correct.
second that.
And we have a second. Any other discussion or comment? All in favor say aye.
Aye.
All right.
Okay, and next, we have a budget revision for our IMR, that's infant mortality reduction grant. And that looks at like some of the safe sleep and car seat stuff that we do to help decrease infant mortality. And with that, we had an increase of $7,844.
All right. So hearing that, I make a motion that we adopt this increase in the infant mortality rate grant fund of $7,844.
Second.
And any other discussion or comment there? Hearing none, all in favor say aye. Aye.
Okay, and our last budget revision is for COVID funding, and that's, we have a budget increase of $228,183.
All right, so,
I'll make a motion that we approve that one.
And that's
Alright.
to help with COVID vaccines initiatives to
yeah, I was
continue
just
with those.
reading the background and explanation there, but yes.
And the salary, that means that you will be able to hire an individual to do the vaccinations, or?
Well, yeah, we may have some help. We have some interns that are kind of helping, so we were thinking, they do some stuff with COVID already. And so we were thinking we could use some of that funding to
We
kind
could
of
do
help
that, or
supplement.
the nurses that we already have, we can pull it down from this grant instead of use different funding. Just keep in mind, this funding, we've already approved, I believe, at the last meeting we had, we approved COVID 716, and this is additional, just the -1.
Okay.
So the last time, I believe it was more for supplies, incentives, and things like that. So this one was taking more and doing contractual and salary.
Okay.
All right, so Dr. Davis made a motion. Do I hear a second?
Second.
All right. Any other comment or discussion? All in favor say aye.
Aye.
Any opposed? And that carries unanimously as well.
Okay, and next on the agenda, we were asking approval to add a new fee. We're switching one of our vaccines we normally use a vaccine called Pentacil, and we're switching to a brand called Pediarix. And so we just need your approval to switch, to add that to our fee schedule.
All right. So do I hear a motion we
Sure, so
add
moved.
this? Do I hear a second?
Yeah. Second.
Second. All right. Any other discussion? All in favor say aye. Aye. Let me just say, I trust you.
Well, I have some information about that, if you have questions about the the Pediarix.
Yes,
Or Dr.
ma'am.
McBurney may can elaborate too. Okay. If you have any questions.
All right. I think we're good.
Okay. All right, next, moving on, we're, every year we do an old balance write-off. I know most of you are familiar with that. And that's a policy in the health department that we have to place somebody in debt set-off or write off their account if they've had no activity in the last 3 years and they're not eligible for debt set-off, so we have to write off those accounts. We do participate in the debt set-off program, and Chanda does our debt set-off program. So she's an expert on that. She's done a great job since taking on that position. If they go into debt set-off, that means they owe more than $50 and they've not made a payment in the last 90 days. And then after 120 days, they get sent a letter notifying them they've been placed in the debt set-off. And that's where we can collect their state taxes, their refund that they're owed. Okay, we cannot collect from lottery winnings. We cannot. Oh, we can. Oh, sorry. We
Yeah.
can collect from
Yeah, if they win the lottery, we can get
Okay.
our money.
We win the lottery.
Yeah, we win. So hope they win.
In 2021, 22, we've sent 480 letters to accounts that have been placed in debt set-off. They've collected from debt set-off $178,720.82. And then we continue to collect once they file their income taxes. Currently, we have 195 accounts totaling, that we were asking to write off, totaling $16,457.91. And I probably think this is probably the lowest we've asked to have written off, if I'm not mistaken. Isn't it?
That's really good.
It's actually really good.
Yeah.
Out of the,
A lot
go
of
ahead.
that might be due to COVID, because we can't place them in debt set-off if they had any kind of activity at all in their account. And with people coming to get COVID testing or vaccines, that's activity. So in 3 years, it may be a little higher than expected, but I think it's a lot of Shannon putting those letters out there.
So there again, we're asking for, it's 195 accounts totaling $16,457.91 that we're asking to be written off.
All right. So do I hear a motion that we approve this write-off of $16,457.91?
I make the motion that we write off this debt.
All right, do I hear a second?
Second.
All right, any comment or discussion? And it's worth noting, you said that's the lowest number that we have,
I think so,
In
that I know,
several
of, so it's
years.
been the lowest that in years that we've
Yeah.
asked to be written off.
so.
I do want to say that since we started the debt set-off program in 2003, the health department has collected $3,684,883.69.
Right,
So,
so it's a good
works.
program,
Yeah.
well worth it, so. But we appreciate the hard work that goes into that. I know that it takes a lot of time generating that, keeping up with it, and trying to get folks to pay their bills, so. So we have a motion and a second, and all in favor, say aye. Aye. Any opposed? All right, so we appreciate that again.
and I'm going to stay here because after Anna talks, I'm going to.
So we're going to have a report on child health, and Jeannie's going to give us that.
Yes, Jill is not with us today, so I'm going to do Jill's report. And you should have at your place setting, you should have the child health report. I'm not going to read over that in detail because you can see that. I'm just going to highlight some of the stuff. And you know, a lot of this is a year or two behind, so this is released in 2022, usually in February, but the data is usually a year or two behind. So in 2020, Caldwell County had a population of 15,501 children that were under the age of 6. We had 733 live births in Caldwell County. Some of the things to note that were on a positive note is the preterm deliveries were down from 12.4% in 2019 to 9.7% in 2020. So I think that speaks to access to early prenatal care and trying to get women into prenatal care earlier so they have a healthier outcome at their delivery. Child deaths are down from 85.7% to 67.7%. Some of the things that to note, I think, are likely a lot due to COVID. There were a lot of missed preventative appointments, like well checks for kids, and I think that was just because people didn't have access to that. A lot of offices were closed except for just sick visits, so it was harder to get kids in for well checks. Children under 1 had a higher percentage of receiving their well check versus those under 5. About 5.1% of children under 1 missed their appointment compared to 22.9% of children 1 to 3. And then some things to note for the health department in 2020, this is to date, as of today. We've had, I don't know if you're familiar with our case management program we do for birth to 5. That's children that are considered kind of high risk, either because they were born prematurely or have some kind of medical diagnosis. But they've received 340 referrals for those children. They're currently case managing 135 of those. And then our clinic has completed 223 well child visits just since 2022. Any questions with those?
I had a couple, and this is mostly for my knowledge, but when we say child population in 2020, where's that number derived from? I mean, school system, birth records? I'm just curious.
It's usually off the state statistics.
The state statistics or the census, that sort
Yeah.
of thing.
Yeah, okay. So if somebody didn't do their census correctly, then we might have missed.
Right. Well, and
There's
the
definitely
one good thing about when you're dealing with child, a lot of that's vital records, and so you
Right.
get a lot of their data from birth certificates. So it's a little more accurate
Yeah.
than some of the adult stuff because
Yeah.
of the birth certificates.
And the number of births, those 733, we're capturing those through, I guess, Register of Deeds office and.
Because I know even though our county doesn't deliver anymore, those birth certificates still get logged in our county because they're a resident of our county. Is that not correct? Okay, sorry about
and
that.
that's
No, it's
what-
only,
yeah.
only births that
That-
occur, so the only birth certificates we're doing now are people who are born at home or.
Okay.
So
We're
you're
on
going
the way
to
to
you're
the
going to see
hospital.
that number really decrease
Yeah.
then.
number's
Well,
gonna go down.
But now that may be.
But I think
that-
we still get them through vital records.
Yeah, I was gonna say,
you
you
may not
still
at
get
the
them
Register
through
of
Vital
Deeds.
Records, not through our local
Yeah.
office, but State Vital Records is still logging what county they
Reside in.
reside in. And so
Okay.
that's where you're getting the 733 is pretty comparable
Yeah.
with what it's been in past years.
Okay.
But yeah, there's just, those birth certificates are not actually getting logged in Caldwell County at this point.
Yeah.
now.
So I got a quick question, and it's something we may have to look at later, but do you know where it says like health and wellness, the infant mortality, do you know why there's dashes at the 2020, or is that just because it was 2020 and?
I don't know if they
Let's
just
talk
weren't
about
able to collect that because they didn't have that for teen births either. So I'm
Okay.
not sure if they were just, because of COVID, some of that information was not available.
Okay.
But I noticed that as well too. I know in 2019 it was 12.5%.
Yeah, and I've got it from like 17, it was 7.7, the live births, and then 2018, it was 3.9, and 2019, it went to 12.5.
Yeah, because we had that one year that we were the best
Yeah,
that
we
we
were
had
the
ever
best.
been.
Yeah.
And then it jumped back up again, so. But I'm not sure why, and they don't have it. I imagine it's because of COVID.
Oh, the data that went
Yeah.
through.
very well. I will say this, I had 2 grandsons born in 2020, and it was a turbulent time in the middle of COVID to have children born at the hospital. And so I'm sure that it was hard to get all these records correct too, so. All right.
All right. And then I'm just going to do a quick QI report. We have a QI council. We have not met a whole lot since COVID, but we've tried to work on some kind of projects. I know we talked about, last year, we talked about the vaccine pods that we had used as a QI project. And so this year, one of the things that we looked at was kind of restructuring our organizational chart. I know Anna brought that to you guys back in January. And so we looked at kind of dividing Anna and I's programs. And so Anna has environmental health, health ed, WIC, and management support. And then I kind of supervise all the clinical positions like dental, child health, the clinic. Let me remember. Is that it? So all the clinical and maternity. Yeah, so I kind of supervise all the maternity. So, you know, in January, our school nurses all went under the education center. So we kind of looked at kind of how to streamline some more of our clinical services, because that was a lot of programs for one person to supervise, because they have CD, STD, adult health, child health, primary care, sick care. So there were a lot of programs. So we kind of, in March, we kind of divided those programs up a little bit more. And so Jill became our clinical and child health director, clinical and community services director. And Lisa became our CD, STD director, because we have an increase in like a lot of the CD diseases, especially, you know, with COVID, syphilis, and Hep A. So we kind of streamlined some of those programs. And a lot of that was to kind of help morale a little bit too. So for things not to be so overwhelming. So that was our QI project for this past year. And I think so far, things seem to be going well with that.
Well, good. All right, any questions of that? I appreciate you being proactive and trying to limit the stress of some of this. I mean, we're on the heels, I guess, of a pandemic that we've been dealing with for 3 years.
Yeah.
Yes.
Yeah, it's been a challenge.
It's been a challenge
Yeah, it has.
and stressful.
Yeah. But I think
So-
our health department's handled things very well, you know, considering.
I would certainly echo that. So we appreciate it.
You know, I was at a retreat yesterday, and I told Jeannie this earlier. It was with like 5 other health directors. It was Region 2. And one of the questions was something that you won't forget about the pandemic and stuff that's positive, not the negative, because we all going to remember some of the negative stuff. But the first thing I ever said was teamwork. That's one thing our health department did no matter what. Everybody jumped in. What can I do? No hesitation. So that's one thing Jeannie and I, without a doubt, can say we're proud of, is everybody just jumped in, didn't care,
Right.
and they helped. So
Yeah.
That's awesome.
All right. Someday it might be worth recapping all that we did do, especially in vaccines. And I know when I went and got my vaccine in different areas that were set up, folks that were there helping, nursing students that were there helping from community college. I mean, it was a big effort and certainly well recognized and appreciated. So, and with that, I'll kick it over to Anna for an accreditation update.
yeah, so our department is really busy right now. We have our accreditation date. It's January the 25th. It's a partial virtual visit. So what that means is we might have like 2 site visitors that actually comes to the health department. The rest is going to be through Zoom. We have to submit all of our evidence by December the 23rd, if I'm mistaken. And at like 5 o'clock, everything shut off for us. We can't add any more evidence. We can't do anything through a new dashboard system they have. And then it opens back up 2 days before our accreditation date. It's Honestly, I believe it'll be helpful for us and our accreditation coordinator, just because when it opens back up, they will already have all the questions for our staff, if they have any. They'll already turn some evidence green, meaning they've already checked it off. They don't have to worry about it on the day whenever they come. If there's anything yellow, which that means is we need to work on it or we need to add more evidence on there. So the dashboard is new, the partial visits are new. Staff is a little stressed with it coming on, but like everything happening, they'll knock it out. It's just one of those things. And I'll mention too, kudos with staff here lately with our monitoring visits. I believe it was September the 15th, if I got that right, that all monitoring letters had to be sent to me for accreditation from the programs at the state level. I want to think that was a good month where there was monitoring visits at least once a week. We had BSEP, family planning, maternity, and the last one we just went through was preparedness. BSEP was the week before, and it's something that, should be ongoing, but not all at one time. And so for our staff, it's like, oh gosh, we got to get this, make sure we're perfect with this. And so kudos to them for handling everything well. We have all of our letters. No caps, everything's perfect for accreditation, but just thank you to our people for handling all that smoothly. And just accreditation's just around the corner on the 25th, and, we're ready for it. I think the system they have in place will really benefit us going forward, so it won't really not take as long, but we can already have these questions answered whenever it comes time to it, so.
And I guess from my perspective, again, it's worth noting, accreditation is not something we're just trying to cram in here in the last little bit of time.
Right.
These folks have been working on this since the last accreditation, right? We start as soon as
and honestly, it's every 4 years.
Yeah.
So what happened was, during COVID, they told us, we'll push accreditation off a year. 21 got here, we'll push it off another year. So health directors were like, okay, we're not responsible for those 2 years. That's not the case. We're responsible for 6 years of information. So throughout the entire 6 years, we've been sending, Brittany Raby is our accreditation coordinator, we've been sending her evidence. What we have to send to her now is things that's happened in the last 12 months or 24 months. So that's been one thing that's been a little different with this cycle.
Yeah. All right. Anything else there?
Nope.
Well, then we're going to invite Mr. Chad Barr, one of our favorite people, up and talk about communicable disease update.
I've asked Jeannie to come up with me for a portion of this presentation. So good afternoon. Today I will give you guys a brief update of influenza, COVID-19, and a newly emerging tick-borne illness called Erlichiosis. New slide? Or do I do it? Okay. So one of the most important things we've learned through the COVID-19 pandemic is the importance of protecting our most vulnerable populations. And as we head into the flu and respiratory seasons, the Caldwell County Health Department has been proactive in administering the influenza vaccine and COVID-19 vaccines, really, to those most vulnerable in our long-term care and our skilled nursing facilities. And so I've asked Jeannie. Jeannie's been instrumental. Jeannie and her team have been instrumental in going out to these facilities to provide these services from the health department. I wanted her to give you an update on all the places she's been and visited.
Today, we went to Rockford Inn in Granite Falls. We've been to Quintanilla, Grandview Villa. We did the National Night Out, as you've seen, on Tuesday. And we've been to the Hudson Police Department, and we have the Sheriff Center scheduled tomorrow. And then we'll do the Senior Center next week. And we've given 167 vaccines to those facilities.
And I can tell you that, I've heard from several of the facilities on how much they really appreciate the health department willingness to come out and vaccinate those individuals who they can't necessarily take to get those vaccines. So
Right.
I think it's a really important service, and I'm glad the health department's involved in that. Moving on to COVID-19, our numbers of positive cases in Caldwell County, they continue to follow the statewide trends. The average number of reported cases during the month of September was 39 cases per day, while the average number reported so far in October is only 16 cases per day. And so it's important to understand that these numbers do not include individuals performing at-home testing. So our data is only including those people who are actually being tested at laboratories that will report that testing. The primary variants for North Carolina are Omicron, BA 4.6, and BA 5. Next slide. So these graphs that you see here were taken directly from the North Carolina dashboard. And the first graph represents, on the left, represents the total reported cases by week of specimen collection, and the graph on the right represents the number of COVID-19 hospital admissions during that same period. And as you can see from the graphs, the peaks and troughs closely resemble, with hospital admission peaks following cases by about 7 to 14 days. So we continue to encourage both primary series COVID-19 vaccinations and the bivalent boosters, and I think they mentioned earlier that they are continuing to give those. And the health department continues to give those on Wednesdays and Thursdays of each week. And I've seen them, it's been very busy recently with individuals coming in for those boosters. Okay, so the next thing I want to talk about is this newly emerging tick-borne illness that some of you may be aware of called Erlichia or Allergiosis. Erlichiosis is the general name used to describe diseases caused by the bacteria Ehrlichia chafensis. Erlichiosis was first recognized as a human disease in the United States in the 1980s. But it did not become a reportable disease until 1999, and the first data wasn't presented until the year 2000. So it is a relatively new disease that we're monitoring. And the photo on the left is the Amblyomma americanum, or better known as the Lone Star tick. And the graph on the right represents the number of U.S. Erlichiosis cases reported by the CDC by communicable disease nurses and investigators from 2000 to 2018. You can see that there's a sharp increase during that period of time. Next slide, please. So the white-tailed deer are the primary host for the Lone Star tick. However, humans and other animals like dogs, cats, livestock are all incidental hosts of this tick. The geographical range of Erlichiosis cases depends highly on the species of the tick causing the illness, and the Erlichiosis is most frequently reported from the southeastern and south central United States, from the East Coast extending westward toward Texas. In 2019, 4 states, that's Missouri, Arkansas, North Carolina, and New York, accounted for nearly half of all the reported cases of Erlichiosis in the U.S. Next slide. This graph shows the number of Erlichiosis reported from 2000 through 2016 by the month of the onset. And although the cases of Erlichiosis occur really throughout the entire year, the majority of the cases of illness onset happen during the summer months, with a peak typically around June or July. Now, this period coincides with the seasons for increased numbers of adult Lone Star ticks, and increasingly all stages of this tick feed on humans. However, only the adult ticks are the ones that spread Ehrlichia to humans. Early clinical presentation usually begins around 1 to 2 weeks after the exposure, and these tick bites are usually painless, and people usually don't remember being bitten. The size of this tick is very, very small. Early signs and symptoms usually within the first 5 days are usually mild to moderate and include fever and chills, headache, muscle aches, nausea, vomiting, diarrhea, sometimes altered mental status, and a macular, papular, and petechial rash occur in about 1 out of 3 children and sometimes adults, but not often. Now, the late clinical presentation for this can become much, much more severe, including meningitis, meningoencephalitis, or other nervous system, central nervous system involvement, and that happens in approximately 20% of patients that delay treatment. The other late clinical presentations include ARDS, septic shock, multi-system organ failure, and death occurs in 1 to 3 patients, 1 to 3% of patients that delay treatment. The treatment for this is doxycycline. That's the first-line treatment for adults and children of all ages. And adults, it's 100 milligram capsules every 12 hours for 7 to 10 days. Children is 2.2 milligrams per kilogram body weight twice daily. And then there are alternate treatments like rifampin for individuals with doxycycline allergies. Now, the individuals at highest risk of this are most commonly reported as men in their late to mid 60s, 60 to 69, who have compromised immune systems, and that's usually from cancer treatment, advanced HIV, organ transplant, or other medications that cause them to be immunocompromised. Next slide. Deterrence and prevention of ehrlichiosis includes the following: know where to expect tick exposure, wear light-colored clothing, tuck pants into socks, use insect repellent like DEET, and regularly examine the body for ticks. So the reason I came to you today and decided to talk about ehrlichiosis is ehrlichiosis cases, as throughout the United States and in North Carolina, have been increasing in Caldwell County, especially in the Happy Valley, Collinsville, and Granite Falls areas. There have been 36 cases so far this year of ehrlichiosis in Caldwell County. Now, that's up from 12 cases in 2021 and only 7 cases in 2020. So as a communicable disease nurse for Caldwell County, I wanted to bring that to your attention, that we are seeing a sharp increase in these numbers. And I wanted to make you aware of that concerning data and help in any way I can to get that information out to our public for the next tick season to prevent these ehrlichiosis cases to continue to increase. So are there any questions, first of all?
What is that tick season? I mean, since we're approaching winter, is that
Yep.
gonna?
So there is, like I said, ehrlichiosis cases throughout the entire year, reported all 12 months of the year. However, the majority of cases are June and July.
Yes, sir.
That's when most of these cases are reported, yes.
Is there some type of test that they can positively confirm this, like you do with Lyme disease?
There is, and it's very similar to Lyme disease testing, including, Lyme disease, the Western blot test.
Right.
However, with this test, it's an IgG immunoglobulin, and it is to get a confirmed, it is to get an initial test, IgG, to take the doxycycline for throughout the entire series, to wait 1 month and then be retested.
Okay.
They check those titers, and if there's a 4-fold decrease in those numbers, that's considered a confirmed acute case of ehrlichiosis.
Thank you.
Sure.
Yes, sir. Thank you.
So the board will receive a full communicable disease report at our next meeting in December, and it'll be a full end-of-year detailed report on all of communicable disease. Okay? All right, thank you.
Very busy.
Yes.
Thank you, Chad.
All right, thank you.
Thank you.
Thank you, Chad. I think that brings us to the end of our agenda. So unless anybody has anything else, I'll entertain a motion for adjournment.
Motion we adjourn.
Do I hear a second?
Second.
All in favor say aye.
Aye.
Thank you again for being here. Thank you for watching, and hope that you have a safe evening out there, and thanks for all you do for Caldwell County.
Thank